if there are 43 million people that are poor, and the largest number of them might be African Americans and Latinos, Obamacare was made for them. Obamacare was not made for anyone who earns more than 400% of the poverty level. If you earn more than 400%, which is a family of four, 92,000, you will have a tax. If you are less than 92,000 for a family of four, you will have a subsidy. That's the difference. And so healthcare reform for the Latinos, legal, is going to be something that is going to be very good. For the illegal, they have no chance ever to join any program, even if they can buy it. And the other thing is that in the exchanges, the only exchange that is not up and running is the Spanish speaking. It will be done at the end of October. So if we are the ones who need it the most, and if we are the ones who were promised so much, the one that is not ready is ours, I think that we deserve a little bit better than that. The most important thing is you have to have a computer or you have to have a phone, because it takes a long time. So if you have one that is battery, you might run out of your battery before anyone reaches you in it, because we have tried it. The other thing is that the Hispanics are confused between what is Obamacare and what is the healthcare reform. In a poll, they hate Obamacare, they love healthcare reform, so that confusion has to stop. Second, the people have not been informed what is it for them to understand it. If there's not my web, how can I understand it? And the other thing is that it's only thrown at you as the panacea of everything, but really it's not going to be a panacea when this really time comes. The good news is that once you get into it, you're going to be able to get yourself 4 different types of plans: silver, bronze, gold, and platinum. What people have to understand is that the lowest is your premium is the good news. The bad news is that the co-deductibles and the co-pays have been delayed for a full year, and we will not know what is it going to be. The third thing is that you need at least 2.7 million young people to join so that they will share the load of the cost of the ones with conditions that will be added now, and the elderly, which is about 20% over the age of 85. Preventive care in this law is going to be very important, and is the only service that will have no copay. And therefore, you must be able to push for that. Is the prevention, as of today, God knows what is going to come at the end of 1 year. They cannot charge you a copay. They cannot charge you, nothing is free. Prevention is free.